Oh, fuck, they're so gone. So I can keep continuing posting videos until they're back. At least he has to work today. I'm not sure what the fuck my mom's doing. Um, the White House is still, but let's get to the video. But the White House is still cherry picking pandemic safety rules they always do. Health experts are working with Fat Ass 45's coronavirus task force, and they're accusing the White House officials of ignoring the guidance issued by the Centers for Disease Control and Prevention, also known as the CDC, as they try to stop the spread of the coronavirus within the complex. Um, Over the last several days, Fat Ass 45's administration officials have attempted to quickly pull together a plan to mitigate the burgeoning outbreak in the White House. But as positive test results have poured in, officials have struggled to make decisions about who should be asked to work from home, whether White House personnel should wear protective masks, and even if they should begin contact tracing. These sources familiar with that process told the Daily Beast. Called off guard by the significant uptick in new cases, White House officials have turned to the CDC, which is the definitive source of information about how communities can imagine how communities can manage the spread of the COVID-19 spread, but instead of fully embracing the CDC's guideline, the White House has selectively chosen which provisions to adhere to, two senior administration officials said. It's like they went through, read one sentence on one web page and decided that's how they're going to justify all the things they were going to allow to happen. One official said that includes things like not isolating and not wearing masks and not wearing the masks. The White House defended its health practices in a statement with spokesperson Joe Deere, saying that the American people can rest assured that the fat asses returned that the White House with the fat asses return to the White House, it's taken every precaution necessary to protect not only him and the first family, but every staff member working in the complex to support the federal government's operations consistent with CDC guidelines and best practices. The Washington Post reported on Tuesday that officials were severely limiting foot traffic in and around the fat ass, while Deere said that those near him would wear the appropriate PPE, sorry. But officials confided to the Daily Beast that they felt nervous about even showing up, fearing that their place of work had become a COVID hot zone. Some were blunt in their dismay with Fat Ass 45 and worried about possible interactions with him in the near future. He's the fat ass. We can't run away from him if he approaches, a senior administration official said. But the circle of people who feel comfortable telling him that if he's being inconsiderate is very small. At issue, is that some officials are describing as a lax standard around combating the pandemic, even as it has entered the White House gates. White House officials have continued to say that wearing a mask will not be a requirement, and the CDC only recommends its use. The CDC guidelines do use the word recommend, but they also say that the masks are more likely to reduce the spread of COVID-19 when they are widely used by people in public settings. The agency also says that if you are sick, you should wear a mask over your nose and mouth if you must be around other people or animals, including pets, even at home. Fat Ass 45, a COVID-19 patient, removed his mask Monday evening after um, returning from the Walter Reed Medical Center. The White House has said that it is contacting individuals who came within 6 feet of Fat Ass 45 for at least 15 minutes, starting from 48 hours before the onset of the illness. But CDC guidelines says that the White House should also be counting all those individuals who came close to Fat Ass 45 in the time leading up to his isolation. The problem is that Fat Ass did not stay isolated. He took a caravan tour around the Walter Reed Hospital on Sunday and came into contact with the security guards and drivers. And then Fat Ass 45 then returned to the White House on Monday and took off his mask. The White House originally indicated that the medical unit was solely tracking Fat Ass 45's contacts, but on Tuesday, senior White House officials said that the unit had expanded its efforts and was conducting contact tracing for all White House personnel. The CDC, the DC mayor's office offered to help the White House, but never heard back. A source familiar said. Members of the White House, including the fat ass himself, have long bristled at following the CDC's COVID-19 guidance, often challenging the agency for being too restrictive and overly cautious about the disease. The White House even pressured the agency to dial down the coronavirus death counts in the U.S. The move to now follows only parts of those guidelines, with COVID rampant within its walls underscores the extent to which officials have internalized the fat ass's public relations demands over the scientific consensus, and it comes at a time when Fat Ass 45 and his inbred loyalists continue to downplay the threats the virus poses and attack those who take abundant precautions. On Tuesday, the vice squatter, dumbass Pence's press aide, Katie Miller, dumb cunt, mocked Senator Kamala Harris's team for proposing the use of plexiglass separators at Wednesday's vice president debate, even though even though the CDC recommends its use in work settings when applicable, and even after the outbreak took hold for the White House, officials working there walked the halls without masks, though senior officials eventually mandated that everyone wear masks on the campus. Further, further complicating matters is the secrecy with which the fat ass and his team have operated since the COVID outbreak began at the White House. The administration has implemented a strict policy of secrecy, telling those who tested positive to keep results quiet. Two sources familiar with the matter said others were told to seek answers about whether they should be tested from their own personal doctors rather than the White House medical unit. And the fat ass's doctor, and head of the medical unit, Dr. Sean Patrick Connolly, has not answered questions about when the fat ass last tested negative or the results of his lung scans. Amid all of this, a COVID-19 positive fat ass 45 has continued promoting his own administration's public health guidelines. Even on Tuesday, the day after he arrived back at the White House after his brief stint in Walter Reed Hospital, the fat ass wanted to escape the confines of the residents and head elsewhere, including the Oval Office. Two sources familiar with the matter told the Daily Beast, confirming earlier Bloomberg reporting by Tuesday afternoon. Fat ass 45 had accepted advisors' counsel that it was a bad idea to roam around, though close aides wondered how long this mild display of discipline would hold. The fat ass's stir craziness early this week occurred against the backdrop of a continued rise in the country's COVID-19 body count, which has already topped more than 210,000 deaths. In the halls of the White House, distress and anger among officials were palpable, according to interviews with three knowledgeable sources in the administration. Some still nursed ire at Fat Ass 45's Chief of Staff Mark Meadows, who they blamed for the internal disarray and lack of clear guidance beginning last week. Several former senior White House officials said that they had felt blessed to no longer be working in the White House for the sake of their own safety and the health of their families or friends or strangers to whom they potentially could have brought the virus to. Through it all, Fat Ass 45's attention has remained focused largely on his own political fortune. In the past few days, he made a point of telling people close to him that getting back on the campaign trail as soon as possible and to his Klan rallies is a top priority for him, according to a source with direct knowledge. This week, the fat ass conspicuously did not mention the need for any substantial changes to the way he and his team have campaigned lately, even in the face of his own diagnosis and urgent hospital care, the source recalled. He wants to get back to how it was and really is a dumbass to-do list. So if you like the video, give the video a like and subscribe to my channel, Random Mike, and also hit the notification bell so that you'll be notified when a new video comes out, and thanks for listening.